Hello and welcome to World Health Report, the October edition with Dr. Bret Palmer. COVID cases are still increasing worldwide, and cumulatively they are still increasing. They don't show any sign of levelling off, as we can see from the graph behind me. Back in May 2020 there was 4 million cases, but since then up to now there's just under 36 million, with over 1 million deaths. And unfortunately, as we can see from North America and Europe, it is now winter in the Northern Hemisphere, and so the spread is just going to keep on spreading. There was a little respite in Europe because people were covering their face and washing their hands and keeping their distance, and the sun also helped in sterilising surfaces contaminated by COVID. Unfortunately, it is now winter, the temperature is below 35, so we're not going to get much UV radiation to killing off COVID, and unfortunately people are not keeping their distance or wearing face masks, but we'll come on to that in a moment. So who's more at risk of COVID-19? Well, increasing age, male, and people with comorbidities. The sort of comorbidities we're talking about are people with chronic heart conditions, chronic pulmonary conditions, obesity, type 2 diabetes mellitus. And if you're wondering what that means, diabetes means passing through, and mellitus means sweetened with honey. Comes from Old Latin. All it means is there's sugar in your pee, and you're peeing quite a lot of it. And so if you do have type 2 diabetes, it's very strongly linked to obesity. There's also chronic kidney disease and liver disease. Smoking also causes many of the diseases, which I've already mentioned, and if you can stop smoking and cut down your weight and start getting fit, you will go a long way in increasing your chances of having a good outcome if you happen to be to catch COVID, especially if you're from the older generation. There are also long-term consequences of COVID as well, notably fatigue, shortness of breath, joint pain, chest pain, cough, loss of sense of smell. We don't quite know how long these go on for because it's a new disease. One thing we do know though, that it can attack the heart muscle and also the lining of the heart, causing myocarditis and pericarditis. This in turn can then cause cardiomyopathy, which is the heart not beating correctly. This can contribute to fatigue as well as shortness of breath. In terms of slowing the spread of COVID-19, you have to wash your hands frequently, wear a face mask, attempt to keep your distance, and stay in a well-ventilated room. In other words, lots of fresh air. So hands, face, distance, and ventilation is very important. Try to avoid contact, and if you can, work from home. And obviously common sense, if you're ill or you have a cough or a fever, then please stay away. COVID is here for the long run. So will vaccines save the day? I've been asked a few times. Most likely not, unfortunately. The reason for this is the immunology of coronaviruses, as well as responses to vaccines. So the coronavirus can give a very varied response that we've known from the common cold, and some people have a protection for a few months, sometimes even a few years. Other people have very little or poor protection, and so you can catch it again. We don't know how well vaccines will work against COVID-19, which is caused by the SARS-CoV-2 virus. And the other problem with vaccines as well is they work very well in the young, but they don't work so well in the elderly or the elderly. You tend to get a poorer response. And so it looks like the virus will continue to circulate for a number of years, even if a vaccine is found tomorrow that works in the elderly and staves off severe disease, which is going to be quite a long time before we actually know that. You also have to remember as well, in terms of inequalities, the poorer people tend to be, the more comorbidities they tend to have, and that is why the poor are hit harder with all diseases. Disease follows poverty, and it's very important to remember this when we go on with the rest of the summary. So there are many current pandemics: influenza, TB, malaria, measles, HIV. HIV has killed about 35 million since it's been around. Malaria and measles, for that matter, can kill up to 1 million. Malaria kills about 1 million a year. Measles a few 100,000 a year, and syphilis over the centuries has killed tens of millions as well. Gonorrhea used to kill quite a lot before antibiotics come along, but it is still spread and increasing. And chlamydia, again, some people don't regard it as a serious disease, but if it's not treated, can cause quite a lot of harm as well. In terms of recent past pandemics, SARS and MERS, which are both which are both coronaviruses, and Ebola, which is caused by the Ebola virus. So in terms of other disease updates or outbreak updates, the Democratic of Congo, which is a country a little bit close to my heart because of so many interesting things in terms of diseases and infections that originate from the Congo and the jungles because of human beings encroaching into the jungles. Since June 2020, there's been 104 cases with 47 deaths. That's nearly a fatality rate of 50%. Now, Ebola outbreak in Congo was declared over in April time, but unfortunately since June we've had another outbreak. Why we had another outbreak? Because it's endemic in the bat population, and in the Congo people kill bats for bushmeat if they're not not properly cooked and the food is not properly prepared. It can be transmitted to humans quite easily. Also, in people who survive Ebola, it can actually be spread in vaginal secretions and also seminal fluid for at least 6 months. And so if you are watching this and you're from Africa and you know Ebola survivors, or they're your sexual partners, or you yourself are an Ebola survivor, you should be wearing condoms if you're having sex. Other outbreaks is the yellow fever outbreak that has happened in French Guiana, and that's happened from August the 1st. There's been one case. There's been about 3 cases over the last few years, and this particular case is the first case that has yellow fever and COVID-19 at the same time. In North America, as well as Africa, the measles pandemic that's been going on since 1999 is still raging on. Please remember, this is a vaccine preventable illness. So Ebola, a virus disease, unfortunately continues to spread, and something we must be aware of. In Sudan, there's also the circulating vaccine-derived polio virus type 2. What that means is, it doesn't mean the vaccine has caused it. What it means is the vaccine would protect you against this particular type of virus, and 2 children were reported to have flaccid paralysis. And so if you're traveling to Sudan or Chad, you should be vaccinated against polio. There's also an outbreak of the chikungunya virus with over 30,000 infected and 1 death, and this is caused by infected mosquito bites. Another outbreak is the monkeypox virus, and since January 2020 there's been 4,500 cases and 171 deaths. There is quite a high case fatality ratio in those under 5 of about 4%. Symptoms tend to start with fever, headache, swollen lymph nodes and feeling tired, and then rash forms causing blisters and crusts. Over time, it's quite a typical presentation of a pox type virus, and it tends to last anywhere between 2 to 5 weeks. In terms of the Democratic Republic of Congo, there are many problems in this area, mainly as well as in terms of infectious diseases, including measles, polio, malaria, cholera and COVID-19, in addition to the ever-increasing numbers of the Ebola virus. This particular region of Africa is experiencing quite a lot of armed conflict and violence, and due to its unstable nature, these particular diseases will unfortunately continue to spread as populations experience armed conflict, and there will be quite a few population displacements at the same time. In terms of other areas of current conflict zones, there are a few mainly in the equatorial regions of this planet, and as you can see them there behind me, a few are worsening, but the vast majority have remained unchanged, and none at the moment are improving. In terms of the weather, there are three major hurricanes and tropical storms that we need to look out for. You have Hurricane Delta, which is in the Caribbean, Hurricane Chan-Hong, which is coming or just passed over Japan, and there is also Hurricane Marie, which is weakening and is coming to the central Pacific. There's also Tropical Storm Norbert as well. So Tropical Storm Norbert is not a hurricane. Hurricane Marie, you can see on this one, just coming to the west of California. In terms of other geological events that is happening, there's been a couple of earthquakes, one in Fiji, which is magnitude 6 on the Richter scale. Others are below 6, and so I'm not going to report on them. And there's also been an earthquake a volcanic eruption in Ecuador, and also in Mount Etna in Italy, which is in Europe. The major droughts that are affecting the world, the longest one at the moment is one in central Western Europe. That's been going on for 29 weeks. They are getting a little bit of rain at the moment, but it will take quite a long time for the water shortages to dissipate in those areas. In terms of current incidents, there's been an incident of Novichok poisoning on a flight to Moscow that occurred on the 20th of August 2020. Novichok is a nerve agent. It is a form of, or it comes from a form of pesticide, and is a substance known as organic phosphorus chemical. And these organic phosphorus substances stop cholinesterase, which are a type of enzyme which are critical for maintaining the activity of the central nervous system. So pesticides target the cholineesterases in insects, and in humans the cholineesterases are targeted, and these agents are then called nerve agents. People generally die through asphyxiation due to secretions, and these secretions are foaming at the mouth, vomiting, diarrhea, and urinary incontinence, and it all happens at once. And atropine counteracts these effects, and that is the treatment of choice as well as supportive therapy. There's been a wide range of Novichok poisonings so far, ranging in Moscow, Salisbury, Aylesbury, Bulgaria, as well as the flight from Tomsk to Moscow. And they are the individuals who unfortunately have been at the wrong end of the Novichok poisonings. Going further afield to space weather, there is no significant space weather to report. So space weather can affect astronauts, satellites, cabin crew in long-haul flights, as well as power grids around the planet. But we'll keep you updated if anything does happen, but it does look like nothing is due to happen from the sun this month. In terms of near-Earth asteroids, and obviously while I'm reporting on asteroids, well, if a large asteroid hits Earth, we'll know about it, and nothing is due to be of any event in October or November. However, there is a 8-meter asteroid coming towards us on the 1st of December, but it will miss Earth. It has a distance, lunar distance of 0.1, and 1 lunar distance is distance between Earth and the Moon, so 0.1 is a tenth of the distance. So it's still quite close, but it is actually travelling quite slowly, only 3.9 kilometers per second, and the diameter is 8 meters, so chances are it will probably burn up and may not even reach the surface of Earth. But we will keep an eye on it, and expect that one in December. In terms of the economic output, unfortunately, it looks very bad, and especially in the northern hemisphere, the economic outlook will continue to deteriorate as COVID is becoming out of hand. This will obviously put a lot of pressure on health services and may end up encouraging governments to do further lockdowns. COVID was going to be here for the long term, and I think a lot of people need to learn, we need to learn in many countries around the world and how we actually live with this particular virus. Well, that is October's World Health Report. Thank you very much for watching. These are some of the websites I've used to put this website together, and thank you very much. Please like, subscribe and share. Take care. Goodbye.